Allora, vediamo questo qua. Vediamo se vedono le slide. Partecipiamo. Ok, perfetto. Mettiamo la presentazione qua. Ok. Good afternoon, dear students. The topic of today is dopaminergic antagonists. So we have already seen the importance of the dopamine agonist used for the treatment of, mainly for the treatment of Parkinson's disease. And now today we'll see the importance of the dopaminergic antagonists. This class was discovered in 1952 by observing the side effect of an antihistaminic compound called promethazine. Promethazine in that time was used to treat the allergic diseases related to some, the allergic response is due by the absorption of particular chemical compounds or by natural compounds, by different sources. It is an abnormal reaction of our body against particular substances because we have elaborated the antibodies, and so we have an abnormal response. Anti-allergic compounds are important to control this abnormal response, because otherwise we need to go to the hospital and they have to inject, the medical doctor have to inject cortisol and other potent anti-inflammatory agents. But why dopaminergic antagonists are so important? Because they are related to schizophrenia. We can read together. Schizophrenia is a serious mental illness that affects how a person thinks, feels, and behaves. We see every day in the newspaper some news related to schizophrenia reaction, husband against wife, daughter, son, and so on, And so, at the beginning, the medical doctor tried to control the violent schizophrenia attacks. And so in that time, the medical doctor tried to use compounds able to block, to control these violent attacks due by schizophrenia. If left untreated, you see, the symptoms of schizophrenia can be persistent and disabling. So it is necessary to control these symptoms. Some years ago, in that time, the first hypothesis to explain why a subject can have violent attack of schizophrenia was related to dopamine hypothesis. In particular, the scientists observed two different behaviors of schizophrenic patients. We have patients with positive symptoms, violent symptoms, and this disease is due by an overactivity of the mesolimbic pathway, an increased concentration of dopamine in mesolimbic, in this part of the brain. Other patients have a different behavior, a negative and cognitive. They have negative and cognitive symptoms. And this different behavior of the patients affected by schizophrenia is due by a decreased activity of dopamine in mesocortical region. So we have two different situations. Violent people, violent patients with a overactivity of the dopamine neurons in the mesolimbic, and negative patients with a problem with the cognition and the willing, with a decreased activity of dopamine in mesocortical region of the brain. This is the main problem of schizophrenia, because in one part of the brain it is necessary to decrease the activity of dopamine in positive symptoms. Otherwise, in case of negative symptoms, it is necessary to increase the activity of dopamine in another part of the brain, in particular in mesocortical, in cortex. So you can understand that we have two phases of the same disease, two different phases. A violent phase, positive symptoms, and not violence phase, represented by negative symptoms. And so, first of all, it is necessary to recognize the type of schizophrenia, because in one case it is necessary to use antagonists of dopamine in the case of positive symptoms to control the violent attack in these patients. In the second case, we have to increase the activity of the dopamine in cortex. So, two phases, but you can understand that the first situation that we have to control is to control the positive symptoms of the patients, because they can be violent against people. And so the first need was to control these positive symptoms by using dopaminergic antagonists. So the first response, the first treatment to schizophrenia was based on the use of dopamine antagonists. These compounds are very potent to decrease the forces to control the violence attack of the patients. The patient remain without any forces. You can see here in the picture the dopamine hypothesis. The original dopamine hypothesis states that the brain of schizophrenic patients produces more dopamine than the brain of a normal person. There is another hypothesis that perhaps in this patient there are an abnormal number, high number of D2 receptors. But anyway, we can use an dopaminergic antagonist, and so we can control the overproduction of dopamine or the overactivity, the over number of dopaminergic receptors. Here you can see again the two phases of schizophrenia, positive and negative. In particular, in positive, you see hyperdopaminergic activity, predominance of positive symptoms, minimal structural damage, relatively satisfactory adaptation. Good response to classic neuroleptics, dopaminergic antagonists. What about negative symptoms? You see low dopaminergic activity, atrophy of gray matter in the prefrontal cortex, predominance of negative symptoms, atypical antipsychotics. We'll see different classes of dopaminergic antagonists, and we'll see these classes classified as atypical antipsychotics because they are not related to chlorpromazine, the prototype of this type of antagonists. Once again, you see negative symptoms, emotional disorder, formal thought disorders, violation of will and inclinations. But the most urgent problem is related to positive symptoms, delusions, hallucinations, psychic automatism, you see. Once again, positive hallucinations, disorganized speech, and also violent episodes, and negative, flattened effect, reduced speech, lack of initiative, you see. In particular, you see the violence, attack, mentalizing disabilities, personality disorders, positive psychotic symptoms, you see. Also in this case, aggression, conflict resolution, impulsiveness, you see. It's really a complex disease. Schizophrenia is really a complex disease. But if we want to resolve the positive schizophrenia, we have to use antagonists in order to control the violent attack by the patients. Once again, diminished expression, you see apathy in case of negative symptoms, and then secondary negative symptoms, you can see a lot of other symptoms. This picture is just to describe you the complexity of the topic. And then we'll see different classes of drugs that can be used for the treatment of schizophrenia. Here you can see a table with the affinity of different antipsychotic drugs against 3 different types of dopamine receptors. The prototype was chlorpromazine. You see, it's a nanomolar inhibition constant. So with a low number, the derivative is very potent. In this case, you see chlorpromazine is selective, quite selective for D2 dopamine receptors. But it's not no, not selective. You see D3 1.2, D4 9.7. So more or less almost the same activity towards the 3 dopamine receptor subtypes. But why the scientists investigated this type of effects? Because there is an important side effect related to this class of compounds. The most important side effect is a Parkinson similar disease. And you can understand that if we block the dopamine receptor, we can have almost the same situation that we have already seen in Parkinson disease. This means that we have uncontrolled movements of our muscles. And so the scientists observed that not all dopaminergic antagonists have the same side effects, these important side effects. So there are some dopaminergic antagonists without this side effect. And so they want to explain why some antagonists present this Parkinson similar disease, similar Parkinson disease, or why others do not produce this side effect. And so at the beginning, they thought that this side effect was related to a particular selectivity toward a specific dopaminergic receptor. So the scientists investigated the affinity for the 3 dopaminergic receptor subtypes, D2, D3, and D4. So the prototype is chlorpromazine is not selective, you see. Clozapine, not selective, you see. Haloperidol, not selective. Olanzapine, not selective. Quetiapine, you see, is quite selective for D2 and D3. Risperidone, not selective. So they conclude in that time that the Parkinson similar disease is not related to selectivity towards a particular dopaminergic receptor. In addition, the scientists investigate also the affinity of these compounds towards other receptors involved in schizophrenia. And in particular, they found that when a dopaminergic antagonist is able to interact, to antagonize also the activity of histaminergic receptor HT2A, you see this particular subtype, they do not present these side effects, this Parkinson similar disease. And so they conclude that it is necessary an interaction, an antagonist activity towards dopaminergic D2 receptors. This is the main effect, against schizophrenia, but also if your compound is able to interact with these other class of receptors, histaminergic receptors, this compound do not show any side effects related to Parkinson. So you see all this table, all this number, just to understand the involvement of these two different population of receptors in schizophrenia, D2 and 5-HT2A. HT means histamine receptor. This is an important finding discovered by the scientists, and we'll see that this class of antipsychotics called atypical because they have a different chemical structure in comparison with the chlorpromazine, the prototype. These atypical antipsychotics have not any side effects related to Parkinson. So no uncontrolled movement. This is an important finding in the treatment of these patients. You see the side effects, the main side effects, similar Parkinson syndrome. And then dry mouth. When you go to make an exam with the professor, you have dry mouth, normal. It's an effect due by an interaction of muscarinic receptors, because the chemical structure of this compound, the prototypes, chlorpromazine and other related derivatives, is very similar to muscarinic antagonists, and so we can have the same side effects. Difficulty of accommodation, the eye. Constipation is the block of the movement of the intestinal muscles. These compounds are not hypnotics, can be considered hypno-inducers because the patient is calm, is quiet, and so can start to sleep. Induce sedation of the patient. But another important aspect is these compounds are not able to lead to respiratory paralysis. We have already seen these important side effects in barbiturates, in general anesthetics, and we'll see the same effects in the derivative of morphine. In this case, these compounds are not able to block the respiratory centers. But why these compounds are important in the treatment of schizophrenia? Medical doctor can control the violent attacks, okay, but also this compound allow the subject to distance itself from a state of psychosis. The subject is able to realize, I have this problem, so I have to control myself. This is the reasons of the use of these compounds. These compounds are also to decrease aggressiveness, of course, for learned stimuli. They have also another important activity. They antagonize the dopaminergic receptors, and you know that the peripheral dopaminergic receptors are involved in the emetic activity. If you use an agonist, we have already explained the effect of L-DOPA, for example, on our body. L-DOPA is an indirect agonist which is transformed in dopamine, and dopamine is an agonist on the peripheral dopaminergic receptors, and this effect is expressed through to the vomiting. So we use an antagonist, we can control this activity. We can control the chemoreceptors, we can block vomiting. But why this effect is important? We have seen a lot of chemotherapeutic agents, in particular anti-cancer agents. These compounds are toxic for our body. They are responsible of a strong vomiting. And so we need compound able to block the chemoreceptors in order to block the vomiting, this peripheral effect of anti-cancer agents. Therapeutic use of dopaminergic antagonists. Symptomatic treatments of all forms of schizophrenia, positive and negative. More in the case of positive, you know. Mode of action. 3 classes are competitive antagonists of dopamine receptors. The last class is represented by reserpine. It's a natural product. And this compound we'll see as another mode of action. It's not a dopaminergic antagonist, but we'll see. It's able to deplete the vesicles of all neurotransmitters, but it is a particular effect, and the reserpine is not in use today for the treatment of schizophrenia. You see once again how agonist and antagonist can interact with the dopaminergic neurons. Here you can see the effect of L-DOPA, other agonist, methyl-DOPA inhibitor. You see, this is a complete table about the effect of all drugs, all dopaminergic drugs. Now we see the different classes of dopaminergic antagonists. The first class is called phenothiazines, unrelated compounds, the oldest compound of this class. Butyrophenones, unrelated compounds, benzamides, and the last reserpine. It is not in use today, no more in use. Phenothiazines, unrelated compounds. Some years, more than 50 years ago, the medical doctors in hospital observed an important side effect after the treatment of the allergic reaction with the promethazine. Promethazine is the best known anti-allergic compound. We use this compound in cream, you see, against allergic reaction, against insect stings and so on. It's very potent. It's also used orally. But if you take this compound orally, you have a potent anti-allergic effect, but also a potent sedation. And the medical doctors observed this effect. And they decided to investigate this important side effect in order to have compounds with this effect as the main effect. So in that time, the doctors wanted to have a potent sedative compound. The chemists tried in that time to modify the chemical structure of promethazine in order to shift its main activity from the anti-allergic activity to the sedation activity. So they wanted to increase potently this type of activity. They performed a lot of chemical modifications on the chemical structure of promethazine. And the most important modification to increase the sedation activity, you see, is related to the replacement, a small change on the aliphatic chain. They saw that starting from a isopropyl chain, you see here, 3 carbon atom with a nitrogen on 2 position, isopropyl substituent, by changing in the linear normal propyl chain, a very small modification of the backbone, the chemical structure of promethazine, they observed a strong increase in the sedation effect. Really, a small modification, a very strong effect. In particular, the first antipsychotic compound used more than 50 years ago was promazine. So you can remember from promethazine derived promazine. Promazine has the same chemical structure without any substituents of the aromatic ring, but the chain is linear, normal propyl chain, not isopropyl chain. After this first compound, other compounds were developed. Chlorpromazine, for example, with a chlorine on the aromatic ring. 3-fluopromazine with a 3-fluoromethyl group on the aromatic ring. And these last 2 compounds are very potent. In this way, the scientists were able to amplify the side effect, the potent sedation of promethazine. Once again, I remember you that this type of compounds are responsible of the similar Parkinson disease as a side effect, because we block the D2 dopaminergic receptors, and so we have a similar Parkinson disease. Here in this picture, you can see the structure-activity relationships of this class. This basic function was deeply investigated. Also, the dimension of the aliphatic chain, the length of the aliphatic chain, and finally, the nature and the position of the aromatic substituent. So we start from the side chain. Normally, the side chain is composed by 3 carbon atoms. No more, no ramification, nothing. But we have some exceptions. You see levomepromazine as an additional methyl group on the normal propyl chain. In the case of thioridazine, you see 1 carbon atom is included in a piperidine ring, but 3 carbon atom remains between the 2 nitrogen atoms. You see 1, 2, and 3. Amino function. Amino function is important. Normally, you see on the nitrogen atom, you can see 2 methyl groups. The scientists try to increase the hydrophilicity of these compounds, because I remember that there is a tricyclic system with a trifluoromethyl group, for example, or with a chlorine group. So these compounds are very lipophilic. But they try to increase the hydrophilicity by introducing this cycle, this piperazine cycle, piperazine, 2 nitrogen atom on the same ring, and on the last nitrogen there are an ethanolic residue, CH2OH. You see flufenazine, where the substituent R on the second nitrogen is this ethanolic residue. Or we can have only a methyl group on this second nitrogen, and in this case we have trifluoperazine. These are 2 important compounds of this class. But the presence of an OH group, of an alcoholic group on the second nitrogen atom, gave the inspiration to the scientists to form some esters on this OH with the long chain fatty acid. Why? If we introduce a long chain fatty acid on this OH, so we make an ester with a lot, 10, 12 carbon atoms, the molecule has a very high assumes a very high lipophilicity. In this case, we can have a reservoir effect. This compound can be concentrated inside the fatty layer of our skin, and this compound can be hydrolyzed very slowly by our esterases to release the free drug with the free OH group. This form is very important when we want to control a very strong, violent patient. Because after the first injection, the effect of this formulation is able to cover a week. And so, before the end of the effect, we can make a second injection. So we have a sedated patient, the case of a strong violent patient, I remember you. And so we can control this type of patients. Depot effect. You see, depot means that this formulation is able to be concentrated inside the fatty layer of the skin, and it is released slowly during the week by the hydrolysis of the ester bond. It's an important formulation called Modecate, you see the commercial name. What about aromatic substituents? Normally, the substituents are present in two positions. You see here, 1, 2, 3, 4, 5, 6, 7, 8. The best position is the number 2. On this carbon, normally you can find the halogen atom or trifluoromethyl atom. Every group is able to attract the electron clouds, a withdrawing effect on the electron clouds of the aromatic ring. So it is important to have a deficiency of electrons on this first aromatic ring. You see position 2 is most important than 3, 4, and 1. And here you can see the different groups. The best are trifluoromethyl, halogen, bromine, so on. Here you can see the activity of the different compounds with different substituents in different positions. And you see one of the best is 2,3-fluoromethyl, 2.4. Chlorpromazine is the reference compound. The activity is 1. In this case, we have more than double activity of chlorpromazine. What about the tricyclic system? Tricyclic system is represented by phenothiazine ring. 3 rings fused together. Bless you.
Okay, thanks.
With a sulfur atom and a nitrogen atom. It is important that the geometry of this system is completely planar. This tricyclic system remain on the plane of the backbone, the blackboard. This is important because in the next chapter we'll see the antidepressant drugs and we'll see some similar chemical structures, but with a tricyclic system, but this tricyclic system does not stay on the plane of the backbone. We'll see. So for a dopaminergic antagonist, it is necessary to have a planar aromatic system, a complete planar aromatic system. Here you can see an example with the introduction of a nitrogen atom on the first aromatic ring. We have the pyridine ring, but in this case the activity is not too strong. Another important modification is about on the nitrogen atom of the tricyclic system. We can replace the nitrogen atom with a double bond. sp2, if you remember. And in this case, the basic group has to stay on the same part of the substituent on the aromatic ring. So only the cis set isomer is active. We have a double bond, you remember, we have a geometric isomery. And so if the two most important substituents remain the same part, we have a cis isomery. In this case, you see we have an hydrogen and a nitrogen atom as a substituted nitrogen atom. In this case, nitrogen atom is has an higher weight, molecular weight, than hydrogen. And also, if we compare the two aromatic rings, you see the aromatic ring with the substituents has a higher molecular weight. And so if these two groups with the higher molecular weight are on the same part, we have the cis isomer, zusammenset isomer. Probably this configuration corresponds to the active configuration to the right position of the basic chain in the interaction with the receptor, probably. How we can change the tricyclic system? Once again, it is important the planarity of the tricyclic system. So we can replace the sulfur atom with a carbon, for example. If we replace the sulfur atom with the 2 carbon atoms, we have a 7-member ring, a 7-member central ring, and in this case it is necessary to have 2 sp2 carbon in this position in order to have a planar 6-7-6 system, 6-7-6 system, because the 2 aromatic rings should remain on the plane. If we insert 2 sp3 carbon atom, tetrahedral carbon atom, we lose the planarity and we lose the dopaminergic antagonist effect. We go in the other class of antidepressant agents. So it is necessary to maintain the 2 aromatic rings on the plane. It's possible to introduce a carbon sp3, yes, but the second atom should be an heteroatom, for example, an oxygen, you see in this case, because the oxygen can maintain the planarity of the 2 aromatic rings. So once again, it is important, the planarity of the tricyclic system, in order to have an antagonistic activity towards the dopaminergic receptors. Is it clear? Have you any questions? At home, have you any questions? At the moment? No? Can you hear me? Ok. Cosa mi dicono? Ah, ok, perfetto. Tutto chiaro. Which are the atypical dopaminergic antagonists? Which kind of chemical structure have these compounds? You see here the most important 3 compounds of the class: clozapine, olanzapine, and quetiapine. All these 3 compounds have a tricyclic system, a planar tricyclic system, once again. But the central cycle is a 7-member ring, not a 6-member ring. And you see the differences between these 3 compounds are related to the type of the first aromatic rings. In this case, you have a thiophene, bioisoster of a benzene ring. Or in the case of quetiapine, you have a sulfur atom instead of a nitrogen atom. The side chains are more or less the same of the phenothiazine, perhaps a shorter chain. And these compounds are not characterized by a similar Parkinson side effect. No Parkinson syndrome. This probably due by their interaction with the histaminergic receptors. Here in the picture, you can see the starting point of the tricyclic system of this antipsychotic, atypical antipsychotic. You see a central 7-member ring, and then some variations on the first aromatic ring. Really, these compounds are very effective. No Parkinson syndrome. And they are used in the case of schizophrenic patients. Also, in this case, it's possible the esterification of the OH group in the case of quetiapine, you see, with the long chain fatty acid in order to increase the lipophilicity of these compounds. Second class, butyrophenones. First of all, I want to explain you the name. What means butyrophenones? So we can go on Kendro. Here. I can share Kendro with Teams. Just a moment. Let's see, where is? No. Where are you? Oh. No. What happens? Kendro. Yes. Just a moment. Where are you? Oof, what is activated? I don't know why. Oof. Okay, I don't know. Okay. Just a moment. Here. No. Here. Where are you? Okay. Okay. You know, perhaps the organic acid. This is formic acid. You see, one carbon atom. And then we have acetic acid. Here. With 2 carbon atoms. And then we have propionic acid. With 3 carbon atoms. And then we have butyric acid. with 4 carbon atoms. Butyrophenones means that there is the residue of this acid inside the chemical structure. In fact, if we see their chemical structure here, you see there is a carbon atom with 3 methylene groups. And on your right, you can see a group that we have already seen in MPTP. If you remember, at the beginning of the chapter of agonistic or dopaminergic agonists, I described you the discovery of a potent toxin against dopaminergic receptors. And this toxin, I remember you, just a moment. Are you here? Okay. If you remember, we have this type of situation. Here, an aromatic ring. Here, an OH group. Here, a nitrogen with a methyl group. And if you remember, the students in that time tried to introduce an ester function, if you remember, on this OH. Some years ago, the scientists investigated the activity of this compound, and they wanted to increase the lipophilicity of this compound. Why? Because if you remember, if we have a lipophilic compound, this compound can cross very easily the blood-brain barrier. So the scientists tried to increase the lipophilicity of this compound by introducing a longer chain with perhaps an aromatic ring. In that time, the scientists investigated a lot the structure activity relationships of this compound, and in particular, they introduced very different chains on this nitrogen atom. And this class of compound, butyrophenones, derived from this investigation. But they discovered no a potent derivative of morphine, but they discovered a dopaminergic antagonist. This is the history of this class. This class derives from another class of compounds investigated for their activity on the morphine receptors, opioid receptors, yes. And accidentally, by fortune, we say, in medical chemistry, we have a term to indicate the lucky for a discovery. Serendipity. We say serendipity. Serendipity, in italiano we say botta di fortuna, a lucky tentative, and they discovered this new class of compound, butyrophenols, just by increasing the lipophilicity of these morphine compounds. So, just a moment. Here. You see haloperidol. Haloperidol is the most important compound of this class. The name is, Italian name is Serenase. 10 drops of these compounds are enough, are sufficient to block a violent subject. Very potent. So, you can see in the structure on your right the residue of MPTP, the residue of the butyric acid in the middle, an aromatic ring with a fluorine in para position. What means a fluorine in para position? When you see a fluorine in this position, it's to prevent the hydroxylation, introduction of an OH group in para position by our metabolism.
Prevent?
The introduction of an OH group, hydroxylation of an OH group in para position by our metabolism. Because in this case, if we want to introduce an OH in this position, it is necessary the release of a positive fluorine. And positive fluorine, it's impossible to see. Normally, if you remember, the halogens have a negative charge, but not a positive charge. So the introduction of the fluorine in this position increase the shelf life, the activity of your compound in vivo. Haloperidol is the most important compound of this class. You see here the general structure, basic function on your right, the residue of butyric acid in the middle, an aromatic ring on your left. A lot of investigation were performed on this family. Here you can see an example with a methoxy group on para position, but the best is a fluorine. This is the anisoperidone. See. Also, the carbonyl group was investigated. The carbonyl group is important for its electron density, not for its ability to give an hydrogen bond. Why we can say this? Why we can say that it is important a high electron density in this position? Because we can replace the carbonyl with another hydrogen. Moment, you see here, pimozide, we can replace the carbonyl with another benzene ring. And the activity of pimozide can justify the importance of the density of the electron density in this position. Also, the butyric acid chain was investigated. The frozen analog approach, once again, if you remember, the scientists tried to block the free conformation, the conformational freedom, sorry, by introducing, you see, a cyclopropyl in this case, just to block, and they verify the active compound was the trans compound, you see, where the two most, the two big substituents remain in the opposite, you see. So we have the trans isomer. This is another example about the amino function with the introduction of a piperazine ring. Once again, we have already seen this type of example. And then pimozide you see here. Okay. Also the carbonyl was investigated, was substituted with the other aromatic ring. You see, in this case, the carbonyl is inside a ring. And this is an important news. Risperidone, this compound, risperidone, has an important side effect because in men, its side effect is to grow the breasts. And in that time, Johnson & Johnson ordered to pay $8 billion of damage. So it's a very recent, this article, just to say. Okay. Have you any questions at the moment? No? At home, have you any questions? Yeah?
No, Prof, it's clear.
Okay, thanks.
I have a question, just out of curiosity. For the haloperidol, you said that because of the fluorine atom, it will not be metabolized and all that. So I'm just curious if because of the fluorine atom, it avoids the hydroxylation. In what way can it then be eliminated? What metabolism will it have to?
Okay, so in this case, okay, just a moment. Okay, in this case, we can have the hydroxylation, for example, of the aliphatic chain. At the moment, I don't know the metabolites of these compounds, but I remember well that the fluorine is specific. If you see the fluorine atom on an aromatic ring, normally it's present to block the hydroxylation of the aromatic ring in that position. Normally it's a para position. I remember. But in this case, perhaps you can have the hydrolysis of this bond between the carbonyl and the aromatic ring, for example, or we can have the hydroxylation of the aliphatic ring. But I don't know at the moment the metabolites. Perhaps we can see in the literature if possible. Yeah. You can make this type of research. You can go by Reaxys. It's very easy. Metabolites of haloperidol. Yeah. If you are interested on it, you can try. Yeah. Other questions? No? Okay. 15 minutes break. Then we drink a coffee. Hello? We start again. Allora.
Hello, Prof.
Hello. So we have already seen the chemical structure of haloperidol and this family of butyrophenones. Here we have an example of a very interesting compound used for the treatment of schizophrenia. As I told you before, we can use dopaminergic antagonist in case of positive schizophrenia, because we have overproduction of dopamine inside the limbicus, or we can use an agonist because we have a decreased release of dopamine in the cortex. The solution was the use of a partial agonist. Here you can see aripiprazole is an example. Aripiprazole is a partial agonist. This means that this compound is able to interact with the dopaminergic receptors, and so is able to occupy dopaminergic receptors, but it has a partial agonist activity. This means that it's not a full agonist. It's not able to activate at the maximum level the dopaminergic receptors, but is a partial agonist, for example, 0.7, 0.8 in activity, and not 1, for example, not a full agonist. But in the same time, it is able to occupy the dopaminergic receptor and to act as a partial antagonist. So, when the medical doctors don't understand what kind of schizophrenia is necessary to treat, they can use this compound because this compound is able to treat the two different types of schizophrenia. It is considered a stabilizer of dopaminergic systems. But there is another problem related to the schizophrenic patients. Their non-adherence to the therapy. Why? Because they understand the activity of these drugs and the effect is not a positive effect for the patient, because the patient feels that they has no more forces in the muscles, no more willing, and so they prefer to do not assume the drug. How we can solve this non-adherence to the therapeutic plan? Here you can see a solution. In the tablet of aripiprazole, a company decided to introduce a sensor, electronic sensor. The patient, after the assumption of this drug with the sensor, when the sensor is attacked by the hydrochloric acid inside the stomach, the sensor is able to form a signal if you see here in the picture, the signal is amplified by an electronic arm patch. So the patients have a patch, the hand, for example, and this patch is able to amplify the signal about after the attack of the pills by the hydrochloric acid. And then the signal is sent to a mobile phone. The signal by mobile phone is then sent to the medical doctor. And so you see the medical doctor knows that you have assumed this type of drug. It's an example of a smart drug. How is possible to put together an electronic sensor with a formulation, with a drug, in order to inform the medical doctor that you have assumed the drug. The therapeutic adherence is really a urgent problem for the old patient. Because normally the old patients have to take a lot of pills. One against the blood pressure, the other against blood sugar, the other against anti-inflammatory. A lot. And so it is important to control the right assumption of drugs by this type of patient. Okay. Last family, benzamides. What means benzamides? Benzoic acid amides. Just a moment. Here. And then I share the screen. Okay. Benzoic acid amides. Okay, so this is benzoic acid. Here you have an oxygen. Here you have an OH. This is benzoic acid. Amide, we have an amide, in this case. Substituent R, general substituents here. And then we can have benzamides. Here we can make this type of compound. Okay. You see, benzamides. But why this compound and why this type of structure is able to interact with the dopaminergic receptors? We can see the history. Just a moment. Okay, here. Okay. The prototype was metoclopramide. The commercial name in Italy is Plasil. This drug is used against vomiting. Metoclopramide is an antagonist of the peripheral dopaminergic receptors. We have seen that dopaminergic agonists are able to increase the vomiting by their interaction with the peripheral dopaminergic receptors. If we block these receptors, we have an anti-vomiting activity. The scientists thought to increase the lipophilicity of metoclopramide. Metoclopramide is not able to cross the blood-brain barrier. And so they thought to increase the lipophilicity of metoclopramide in order to allow its crossing through the blood-brain barrier. How? You can see sulpiride and sultopride. Please note the potency of this compound, 150 times more than chlorpromazine, so very potent. The scientists replaced the substituents on the aromatic ring by increasing the lipophilicity of the whole molecule. In particular, you see the substituent on this sulfonamide group. In this way, they design new central dopaminergic antagonists. So the prototype, the starting point was metoclopramide, a peripheral antagonist, dopaminergic antagonist, and then by increasing its lipophilicity by replacing the aromatic substituents and by including, you see, the basic function in a cycle, they obtained a more lipophilic compound able to cross the blood-brain barrier. Bless you. Salute. These compounds are not characterized by the Parkinson similar disease. So this is an important, a positive aspect of this class. Very potent and no Parkinson disease syndrome. This is an important point. Okay, it's not important, this part about remoxapride. Remoxapride is now no more on the market because it has a aplastic anemia as a side effect, and so a very severe side effect. So it was withdrawn by the market. What about the toxicity of this compound? You can see here remoxapride. What happens on the aromatic ring? You see the metabolism by cytochrome. We have the hydroxylation of the aromatic ring. We have the protection of the methoxy group with the formation of a hydroquinone. Hydroquinone is the reduced form of a quinone. In fact, you see the oxidation of the hydroquinone forms a quinone. A quinone is toxic because can be attacked by nucleophilic groups present, for example, on the active site on the liver enzymes. So if we introduce some quinones in our body, they are able to block the activity of our liver enzymes. But fortunately, we have another important nucleophilic agent, glutathione. Glutathione is able to defend our cells by the toxicity of quinone, because glutathione is able to attack the quinone and to block its toxicity. But you know, the quantity of glutathione in the cell is limited. And so after the consumption of the whole quantity of glutathione inside the cell, other nucleophiles can attack the quinone system. For example, the thiol group present in the active site of the liver enzymes. Here you can see the case of the toxicity of haloperidol. We have already seen that haloperidol is very similar and can give origin to the NPTP. You see here the double bond due by the dehydration of the tertiary alcohol of haloperidol. You see the dehydration, HPTP, and then formation of this toxin able to kill the dopaminergic neurons. So these two examples represent the toxicity of these two different classes. In the first example, we have seen the formation of a quinone system. In the second example, in the case of haloperidol, we have seen the formation of a toxin similar to NPP+. In this case, this toxin is called H for haloperidol, PPP+. The last class, reserpine, I don't know in English. Reserpine is a natural compound. Very common, very used in the past, but now no more. Because it is not specific. These compounds with a very complex structure, you see, it's able to deplete all vesicles of the different neurotransmitters. So you have one shot of hyperactivity, because when you assume this type of compound, you have a hyperdepletion, hyper-release of different neurotransmitters, noradrenaline, serotonin, dopamine, what you want. One day as a leon. So really, but after 2 days, you have no more forces, no more energy, because it is necessary the biosynthesis of new vesicles, and this pathway requests a lot of time, about 15 days. But during these 15 days, for example, your blood pressure is very low. And so these compounds were used in the past also for the treatment of blood pressure. But now no more, because it is not specific. Also used as neuroleptics, you understand, because no more forces after the release of high quantity of different neurotransmitters. What about the toxicity and metabolism of this class? As I told you before, several compounds of this class are characterized by severe extrapyramidal disorders, ranging, you see, from tremor to a strongly pronounced Parkinson's syndrome. This is the main side effect of this class. But there are some exceptions. For example, a typical quetiapine, we have seen, these are typical antagonists are not characterized by these side effects. And also benzamides have not this side effect. What about the abuse, the potential abuse of this compound? The potential abuse is low because the sedative activity is perceived as dysphoric. Dysphoric is the contrary of euphoric. Euphoric, you know the situation when you are euphoric. Dysphoric is the opposite. No willing, no forces. And so the patient feels this activity very bad. And in the case of these drugs, there is a strong non-adherence to the therapy. So it is important, for example, the administration by injection of retard formulation, of depot formulation, in order to cover the whole week. Really, it's the bad aspect of this class. What about the metabolism of a phenothiazine? The 6,6,6 tricyclic aromatic system is very resistant to our metabolism, but also to the treatment of water plants. This means that in the water of the rivers, you can find detectable, important concentration of these drugs, because the skeleton of these compounds is very resistant. This means also that fishes can assume, can absorb these compounds, and then we can have activity also in this type of animals. Really, in the past, we performed a lot of investigation about the destruction of this cycle for ERA. ERA is an important company here in Rimini for the water treatment, and we worked with them for 2 years to try a new reaction to destroy this type of skeleton, but it is very, very resistant. Okay, have you any question at the moment? No more questions?
No, Prof.
Okay, so tomorrow morning, okay, please go. Sorry.
I don't remember the page, but when we're talking about the benzamides,
Yeah, okay.
yes,
Just a
Now we
moment.
have the glutathione peroxidase. Okay, can you come on down? Down again. Yes.
This one?
Yes, I wanted to ask if with the quinoa formation and blah blah blah, making it toxic to our bodies, is it still advisable to administer such drugs?
Please.
I want to find out if, with respect to the quinoa formation, making it toxic to our system.
Here,
Yes.
the formation of the quinone.
And then we have the glutathione peroxidase to counteract the activity, but it can be worn out, and then we can still have the effects of the drug. I'm asking that the particular drug in question, is it still advisable to administer?
Oh, okay. You can see on the folletto illustrativo, you know, on the paper with drugs, normally there are a lot of these instructions. But can I show you a picture? Just a moment. I want to show a picture. It is on my email. Just a moment. It's very. Just a moment. I have to go to my email. Here. Just a moment. It's okay, magnifico. Where is Simone? Okay. You see, can you see the picture? This is the box of the drug, and this is the paper inside. And then you have to write, to read all instructions on the paper. And so it's very difficult to read all the paper or not. I use a drug for my thyroid, and really the paper is so big and they're very small, the characters, so it's very difficult to read. But the company say, oh, but all instructions are inside the paper. Yes, I know. You know, this is the paper. Okay. This is the situation. I wanted to describe you. These examples are important just to understand the toxicity of the drugs, because sometimes you read on the literature, this drug is toxic. Okay, but what? And so, when possible, I want to show you how a drug can be toxic. In this case, the formation of a quinone and then the Michael addiction of nucleophilic compound and so on and so on. Okay. Other case, formation of a toxin, able to attack the neurons. These are two different examples of toxicity of drugs. Yeah. Good or not? My answer. Yes? Okay. So, dear students, we see tomorrow morning, 10 o'clock, and then we start from the two syntheses. Okay. Thanks a lot for your attention. Bye bye, dear students. Bye bye. Arrivo subito. Ok, che così faccio partire.